Hi there, my name is Dr. David Miller. I'm a naturopathic doctor. I'm the designer and developer of SORLEX. I want to give you a little bit of a training video for anyone who is involved in getting SORLEX to the people who need it most. And there's a lot of people out there that need it because 60 to 90% of us get cold sores at least once or twice a year. The training I want to talk about is not just about SORLEX. SORLEX is part of a comprehensive approach. There's a big space for naturopathic medicine or natural medicine here in the space of cold sores because generally the drugs don't work very well. We've got about a 1 day lessening of the duration of a cold sore, normally 7 to 10 days without treatment. You get about 1 day less with Abreva and Valtrex, and as a clinician I hear from people all the time how poorly most stuff works. So I'm talking about drugs that help with stopping maybe replication or fusion of the virus to the cell. So very specific things they're trying to help with. Notice they're not directly killing the virus, because that's one thing I like to hammer home is this is a virus, and medicine's got lots of great stuff. Antibacterials are so very effective when we need them. Now we have to use them judiciously, of course, but with the cold sore, it's a virus, and antivirals, it just doesn't work very well. Really, a proper response to a virus involves the absolute magic of the immune system. The immune function has to be good. And so you'll notice that when someone has the stress of poor nutrient, sort of poor diet, increased stress, mental emotional stress, poor gut function, as we know gut is related to immune function very, very closely, and trauma, you can get a cold sore. I remember I used to get a cold sore from I got elbowed in the lip during a soccer game. So all these things can cause a little bit of a stress to the immune system, and then we often end up with a cold sore depending on our defenses at that time. So when I talk about the immune system with my patients, I often talk about like the software and the hardware. We need the hardware of immune function to work properly. So we need zinc, we need vitamin D, we need proper protein to make immunoglobulins and all these cool chemicals that are absolutely critical to our immune system working properly. But a good resistance or a good army, which is basically what your immune system is, requires good information, so sort of software. The virus is very tricky. It camouflages and sabotages. That's the way you can explain it. It camouflages itself from your immune system and sabotages the things that your immune system does. So a good treatment has to work on the software side of your immune system, and that's where SORLEX comes in. SORLEX is a stimulus that wakes up your immune system to do what it has to do. So in that way, it's more of, I'd classify it more of like a software intervention, because the remedies in SORLEX, and it's a homeopathic remedy, are just information for the body to wake up and clear this virus infection. So the virus obviously will stay in the ganglion of the nerve, it'll stay in the nerve, but SORLEX, I don't think you'll find anything that works faster, because it's software, so it's fast. Now, is it going to work better on someone who has all the hardware versus someone who is very deficient? Absolutely. So, SORLEX is just part of the picture, but if I had to rely on one single thing in addition to basic good lifestyle and diet, it would have to be SORLEX, because we're getting prevention and we're getting treatment in one. And this is what it's licensed for by Health Canada, the treatment of cold sores. So it's not licensed for prevention, but it is a great preventative. I've seen it work for someone quite dear to me, and I know this is not something to talk about with everyone, but I just wanted to share that I've had some good success, and so have other naturopaths, in preventing genital herpes and treating actually genital herpes outbreaks. I only say this to show the power of this medicine. Like I said, used by naturopaths. People know about it because it works really good. It works so good. It's staggering how quickly it'll work. It actually prevent cold sores from happening once the tingle comes. Sometimes, again, probably depends if the person's got a sort of competent hardware immune system. But in the right person, it will absolutely stop a cold sore from coming. So although it's not licensed for prevention, many clinicians, many people use it preventatively. And back to cold sores and the cause of cold sores. It's a virus that lives inside of you. So often people think, oh, we better put on this Abreva, that topical solution, an outside-in approach. Well, that's fine, I guess, as part of a comprehensive approach, no problem. But cold sores are an inside problem, so part of the solution should be an internal solution for the internal cause. We need to wake up the immune system with some sort of stimulus and hardware. Like I said, maybe that hardware is vitamin D, maybe that hardware is zinc. But there's no problem in using something topically, but what people really like about using something internally is that there's no mess, no greasy, shiny cream on your face on something you're trying to hide. So, of course I'm biased, but I don't think there's anything like this medicine in the world. I've only made one homeopathic medicine combination, SORLEX, because it's the only one that has met a really high standard of I can trust this. So it's super reliable, it's fast, it's prevention and treatment. It's a great complement to the other sort of interventions that you may suggest to your clients, whoever they are. You look really smart when you recommend SORLEX because it's so dramatic. The following is so strong. We got a lot of repeat orders, a lot of testimonials. You can check it out on Instagram under intelligent.medicinals and you'll see all these testimonials coming back. I would have to say the efficacy or effectiveness rate of SORLEX is over 90%. Quite a staggering effective rate. It blows the drugs out of the water. I think it's a great complement to other stuff too. Like I said on here, vitamin D, maybe Deep Immune by St. Francis, or medicinal mushrooms, vitamin C. Those are all going to help, but those are not going to give you the punch that SORLEX can. And when it wakes up with this stimulus, the immune system. I have a naturopathic doctor in Owen Sound who says SORLEX is her #1 selling item in her clinic. That is kind of a strange thing considering as naturopaths we're giving out a lot of magnesium, L-glutamine, vitamin D. Her #1 selling product in her clinic is SORLEX. Now, it's sometimes a secondary concern. It's not the first thing that someone's going to the health food store for or going to the naturopathic doctor for. They may be there for some other reason. They say, oh, you know what? I get cold sores. And I mean, the product looks beautiful too. So it does garner some attention. It attracts eyes. So if you have any questions, make sure you just send me an email to sales@sorlex.ca. I'm here to help. I'm here to educate. And I'm here to hopefully change the cold sore market in this country and in North America, because there's a lot of room for improvement, and when we do natural medicine right, we can do it better than drugs, and I think that's the case with SORLEX. So thanks so much to those who are trying to get the word out there, to those who need it, and I hope to hear from you soon. Okay.